Offices have been allowed to reopen in Indiana, but some dentists and patients are still concerned about safety because of the health crisis. Here to talk more about that, Dr. Kevin Donnelly, who is president of the American Academy of Pediatric Dentistry. Kevin, I know that you teach pediatric dentistry, you practice it now. First of all, let's talk about the precautions and protocols that have been sort of developed here to keep everybody safe. What's going to look different as we head to the office versus before?
Well, you're correct. We put a lot of effort into making sure our patients are safe, their families are safe, and of course, our staffs that we work with are safe. The American Academy of Pediatric Dentistry has put together a safety practice checklist, so to speak, and it's based off of the American Dental Association's recommendations and, of course, the Center for Disease Control and Prevention's recommendations, as well as other scientific literature that's out there. And so we want to make sure we're as safe as absolutely possible, but you're right, it's going to look just a little different. Things that will change a little bit are, as I think parents can expect to get a call the day before, and it'd be called a pre-screening to, make sure everybody's healthy, nobody's running a fever, you haven't been out of the country. Then when you get to the dental office, I think you can expect again to be screened. Have your temperature taken to make sure the family and the patients are all healthy at that time. And you're not going to see the typical waiting room. You're going to see a lot of spacing for social distancing. And dentists might even ask you to wait in your car until they're ready to see you, just so that we can be as safe as possible to have that social distancing. Once you get into the office, I think you will see that people are maybe wearing a little more personal protective gear than you saw in the past. You'll see people wearing gowns, face masks, maybe face shield and things. And that's all to make sure that your child stays as safe as possible.
So, based on your opinion, I'm picturing my hygienist, my dentist, they're always wearing masks. Do you feel that now is the right time to open things up? I guess for an emergency, you have to attend to that, but just for regular cleanings, is now the time to start keeping and booking those appointments, in your opinion?
Well, in my opinion, what will happen is, as you know, over the last 6 weeks, mostly we've only been doing emergency care. And so that's what offices have been set for. And for the right reason, we're trying to save the personal protective gear for those frontline emergency room doctors and nurses. Well, now that we have more product in line, we have better control of information on safety and things like that. Yeah, I think it's really safe to open up. People will be making that extra effort. And what I foresee is, as is phased in, is urgent care will become critical right away. And I know at our practice, we have been keeping track of the people that didn't need emergency care, but they still have pretty urgent needs. And we want to take care of them so they don't end up in an emergency room. And then we'll go on and open up. And what a great time to start thinking about, hey, it's summer, and that's when I always have my kids have their dental examinations, just like they get their medical examinations for the back to school checkups. And so I think you can feel comfortable going in, and there might be fewer people there, as you would expect. It might be a little slower pace, which is okay. But yes, it'll be safe for you.
Maybe less time in the waiting room. Dr. Kevin, thank you very much, Dr. Kevin Donnelly. We appreciate your time and expertise.
Well, thank you so much. And people can go to mychildrensteeth.org if they need more information.
Mychildrensteeth.org. Got it. Doctor, thank you very much. All right, it is 8:45. We got to talk weather now, Jim. So on and off rain today and definitely cooler out there.
Yeah, it is. It's just kind of